Hi everyone, Polly here. I'm going to talk to you today about treating babies, infants and children, as I quite often get asked if homeopathy can be given to very little babies. The answer is yes, and I have to say that the results are quite thrilling as a homeopath because they're usually pretty fast. What you find is that because a baby or a small child hasn't had much medical intervention, they haven't had many symptoms suppressed, and so their bodies throw out the most amazing symptoms. They might seem pretty dramatic, but to a homeopath they're fantastic because they tell us really clearly which remedy we can prescribe. It also tells us that we can give the remedy in quite a high potency if necessary because it matches so clearly, and it also matches the vitality of the baby or the child. And so if a child is, say, struggling with an ear infection and they're in a lot of pain, and you can see the symptoms clearly, then it will point you straight to the correct remedy. You can give that, you might give 1 or 2 or 3 doses, and then you'll see a really dramatic improvement in how the child is. I've seen this umpteen times with my own children who've never had antibiotics or drugs from the doctor. Every time they've been ill, they've had homeopathic treatment. And of course they're lucky because they've got me at hand with my full toolkit and every remedy that you could imagine. But it is definitely something to consider if you've got a lovely little soul there and you don't want to necessarily start pumping drugs into them at a very young age. So perhaps you've got a new baby who's struggling with something like colic, diarrhea, vomiting. Maybe you've got a young child who gets ear infections, adenoid problems. Maybe they've got skin problems. The list is long, as we know. There's so many things that children get wrong with them, but as I say, homeopathy can help a great deal. So if you'd like to give me a call, if you want any more information on any of these treatments that can be offered for the conditions that your child may have, then don't hesitate to get in touch and I'll give you some more information. Okay, thanks everyone. Bye.